10 seconds.
Good evening. I'm Chris Ensing. Thanks for joining us again for another temporary broadcast of CBC Windsor News at 6 at 5:30. We've made some changes to the way that we're showing the news in CBC's Windsor's and our local stations across the country, and this is part of that change. Now, as quick as we can, let's get to the big news of the day here. We do want to give you an update. As of today, there are no confirmed cases from the Windsor-Essex County Health Unit for people that they've tested for COVID-19. We do know that there are 2 people that have tested positive for COVID-19 in Chatham, Kent. That was a man in his 50s and a woman who was in her, an elderly woman who had been sent to hospital. We were told she was in stable condition. That was reported earlier this week. As of now, we can say that the people who have been tested by the Windsor-Essex County Health Unit or Windsor Regional Hospital, they have not received a test back that shows that it's positive. This is a very developing situation. We're going to continue to try and seek confirmation on news and information that we've been sent as well. What we can tell you about the number of tests that have come through, there were 260 people in Windsor-Essex that have been tested. 150 of those tests are pending, and we're being told that it could take up to 7 days for those results to come in. Again, a very developing situation here, and our newsroom is working hard to get you the latest information. What we can tell you as well about the border is more details about specifically when exactly that will close to everybody except for essential services. That's going to happen at 11:59 p.m. Now, according to the Public Safety Minister for Canada, Bill Blair, he says that they have noticed that there's been a decrease in the number of people who have tried to cross into the United States since announcing that recommendation from the Public Officer of Health for Canada to avoid all non-essential travel, and we can confirm that that is the case. We do have a bit of breaking news here in our newsroom, and that is that the City of Windsor has declared a state of emergency. I'll go through some of the details here now. Windsor's Mayor Drew Dilkins officially declaring that state of emergency from self-isolation after returning back from Jordan. This has been declared following the province's declaration of the state of emergency, and that does include some big closures here, including the temporary closure of Devonshire and Tecumseh malls. That was something we asked them about yesterday during our show. A lot of people wondering why they are still open. This temporary closure of Devonshire and Tecumseh malls will take effect as of Saturday, March 21st until at least Sunday, April 5th. Now, that's something that sort of really continues to reflect the changes in our schools as well. Residents returning from March break, traveling outside of Canada, as well as advisories from public health officials recommending against congregating groups of 50. So just an explanation on why that's happening there. Again, this is all coming in fairly quickly here. Mayor Drew Dilkins also announcing with that state of emergency that's been declared for Windsor that any retail pharmacy within or attached to the premises will be allowed to stay open. The grocery stores as well. Restaurants, facilities, or licensed under a license agreement will be able to continue to open. But again, you're looking at takeout only. Dine-in restaurants have been told to close. And any site directly to the premises, no access is available from within the interior mall portion. So something is accessible from the outside going in. Again, a very developing situation here. We'll have the latest information on our website, cbc.ca/Windsor. But that news is that the City of Windsor has declared a state of emergency, which has allowed for the closure temporarily of Devonshire and Tecumseh malls. That happening and will come into effect at the end of normal operating hours, Saturday, March 21st, and that will last until April 5th. Continuing here with what's going on in our community, we here at CBC Windsor have been self-isolating and distancing from each other to make sure that we continue to follow the recommendations of public health. I'm going to come over here now to the CBC's Jacob Barker, who we have here appearing by FaceTime. I'm going to pull him up here. Jacob, you've spent the day out and about in the community as we get this all set up. What were you noticing? There was a call to action from some of our local food banks.
Yeah, Chris, I checked in with the local food banks, and they are getting to a point where they need donations. I know food banks are often putting calls out for donations, but I mean, with the layoffs that we've seen at Air Canada and at the automakers, they see that there is going to be an increase in demand, and they're experiencing, fewer donations at the moment. So they really are putting that call out. They say that right now there's only about 10 days left to give out. Usually they work with a lot more sort of food that they have in storage, but 10 days is what they have right now, and they need a lot more than that to really get through this gap where we are going to see more people coming, and at the same time they're changing the way that they operate. One of the I went down to the unemployed help center in Windsor today, and they showed me a little bit about their operation, which has gone from 5 days down to 2 days.
Wow.
And that's one because less people are volunteering, and employees are being asked to stay home that need to stay home, and they've gone from what they call a grocery method of giving out their supplies or the food to people to handing boxes through the door. They want to maintain that 6 feet of safety, that the social distancing that everybody's talking about. So instead of people coming in and sort of picking out what they want to take, they're getting boxes. They said that yesterday they experienced that change in demand. It's quite obvious. Usually they have about 90 families that come to the center, 94 families, and they say they got about 100 more of those yesterday when they came down, when the lineup formed there. So they are already seeing that increase in demand, and they're expecting to see a larger increase in demand. So they really are calling for donations, and not just of food, but also of that is important, of course, if that's what you can give. But what they really do want is cash donations, and also grocery cards. They say that gift cards like that could be a really safe way of handing out food if they're giving people a card that they can hand to them or send to them through the mail. That would stop people from coming down to the center, and that's what everything is about right now, keeping people out of the public. So if they can mail those out, even better.
One of the things
so there's a lot of ways they're changing, just like we're changing how we're doing things here. I'm speaking to you from my living room. So food bank is one of the other services that has to make big changes and also needs donations.
And with you being on this story, again, reporting from your home today because of the changes we've made, how can someone safely drop something off, just to make sure people know how they can give to the food bank?
Well, of course, you can give, if you are giving those those cash donations, that's something that you can do online or send it in. They, of course, are accepting donations at the centers, but everything is being done with this idea of social distancing and keeping a couple steps back from people. So if you do have donations, bring it in, send it in. Any way that you can get it to them, but just make sure that you practice doing it in a safe way and something that's, assisting everybody right now.
Absolutely. Thanks for this, Jacob.
Thanks, Chris.
That's CBC's Jacob Barker there reporting from home. I'm just going to hang up on him there. We again have been trying to give a different version of the newscast here as our show changes technically. What we're going to do now is try and lock in the CEO and president of Windsor Regional Hospital, and we're going to ask him questions from the community. So if you have anything that you believe needs answered, we will be putting those questions to him today, very similar to what we did yesterday with Mayor Drew Dilkins, who, once again, just to recap from the top there, has declared a state of emergency for Windsor. The release just being sent out while we were live here now, and it talks about the temporary closure of Devonshire and Tecumseh malls. So something that you're going to want to keep an eye on. Those closures will start at the end of normal operating hours on Saturday, March 21st, and will last until April 5th, 2020. This is something that we are continuing to follow here today. And as we talk about some of our most vulnerable people who are looking for food, we also know that there's a large number of people in our area who are looking for a place to sleep tonight. And that's something that our Katerina Georgieva has been looking at. Kat, I'm just going to get you to put your hand out there for me. This is, again, the social distancing call. Absolutely. We want to make sure things on TV sometimes look a little bit different. What have you noticed today? Where have you been and what have you heard as far as how our city's helping?
Right. Well, as you mentioned, our city's homeless. They're especially vulnerable at this moment in time. They don't have a place to call home, but the shelters are really struggling right now. And the big takeaway for me today is that social distancing is really, really challenging in these places. So I did speak with Ron Dunn at the Mission. And he did say that they're stopping all of their non-essential services, like dental service, for example, but things like food and beds and shelter, that is not going away because these people have nowhere else to go. So they want to continue to provide this essential service. Now, as I mentioned, social distancing, I just want to paint you a picture right now in terms of what they're dealing with. They feed up to 200 people at a time. So Ron Dunn described this as people being elbow to elbow in the dining hall, and they really want to change that. They want to start staggering people during these meal times, but what that actually requires is extending their times, their actual mealtime allowance, and limiting it to 28 people at a time. But right now they've lost 70 to 80% of their volunteers. So they are having a hard time staffing this. So it's there's the struggle with not enough people and pardon me. And the other thing I really want to address is in terms of how many people are sleeping in the same space. They have 20 to 30 people sharing a dorm. They're housing up to 90 people at a time. So what they're trying to do is allow for more space so that they can move people so that they have more space at night. And the Salvation Army is also seeing a similar thing. They've got 2 people in one dorm. They want to sort of separate them, but they need money to do this. So they're actually partnering with the Welcome Center, and the 3 of them are working with the City of Windsor, and they're also working with the health unit to try and address some of these issues. And I did hear moments ago that the City of Windsor is stepping up. They're going to offer supports with funding from upper levels of government in order to help them out.
Very thorough reporting on this. Thank you. Katerina Georgieva live tonight on our version of CBC Windsor at 6, our Facebook show. Thank you for this, Kat. Again, we want to remind people that we do have the president and CEO of Windsor Regional Hospital on the line. We're going to go to him in a second. We'll take some of the questions that you have in the comments section. At this moment, I just want to update you on a story we've been following very closely. It's of a Windsor man in Morocco who has been told he's tested positive for COVID-19. This is, once again, Rakan Alaran. I spoke with him this afternoon. He's inside of a hospital in Morocco where the door is locked from the outside. It's a version of quarantine. Prime Minister Justin Trudeau has said there's repatriation flights that are available to people if they can get on them. The United States specifically flying people back. He's not going to be able to get on those flights, he says, because of the situation he finds himself in. His spirits are pretty high. In speaking with him today, compared to what they were yesterday, he's feeling good. He says he's relatively symptom-free. He had something in his throat for a while. That's part of what drew him to get tested, but we can let you know that we'll be continuing to follow that story. It's on our website as well, cbc.ca/Windsor. What we're going to do now is we're going to head over here. We've got the president and CEO of Windsor Regional Hospital here with us. I'm going to just pick this up here. Hi, Dave. Thanks again for taking the time to chat with us. How are you doing?
I'm doing all right, Chris. How are you?
I'm doing okay. A lot of us are taking major measures. We are as well. Our show looks a little different. Everything feels a little bit different. We've reached you on FaceTime. I just want to start with the frontline workers here. How are our healthcare professionals feeling now with this pandemic and with the amount of testing that's going on and the stressful time we're all under?
Well, they're no different than the community in the sense of we are, anxious, nervous. They have family, they have lives. But also what they are is this is what they went to school for, what they trained for, their education, their background, all the various mechanisms we've had in place on an annual basis with respect. This is it. This has been around. We've talked about this going back to SARS back 20 years ago. And we've always talked about that this was a possibility, and now it's upon us. And I have to give them an enormous amount of credit. We're getting prepared, and we are prepared. I pray for them on a daily basis.
It's a stressful time, and we're seeing some of the reaction about people wondering why they're not being tested. That assessment center, you laid that out when we did that tour last weekend about how there were going to be very specific guidelines and how certain people would be turned away. Do you find that you're turning away more than even you thought?
No, not at all. Actually, we've seen close to 500 individuals in the last 5 days. we've tested over 50% of them, or swabbed over 50% of them already. So the clinicians are doing a great job. The frontline staff there are doing a great job. A lot of people are nervous, but they, don't come in with symptoms of COVID, and they don't really have any contacts with individuals that would qualify as the clinical definition to receive the swab. However, they're treated no differently than somebody who did get the swab, in the sense of the discharge instructions are identical. Is even if you don't get the swab, go home, self-isolate yourself, see your symptoms. If your symptoms increase, then come back to the assessment center. It's open 7 days a week, or go to the emergency department, but in advance call public health if you can, or telehealth. But again, if you're having trouble breathing or shortness of breath, call 911 and they will screen you, and they will protect themselves and they'll come and help you. But again, following the discharge instructions, we haven't had any issues with respect to people not being able to follow them, or in effect return visits. So again, the issue now is waiting for the results. Is even though we've swabbed close to 250 people, we only have received from that 15 results so far. They're all negative, so there is a little delay, or a big delay, with the results, and the government's working on that and opening up more labs starting next week.
We have a question from Lindy here that pretty much addresses that there. Why can't Windsor itself set up a lab and test here instead of sending it to Toronto? I believe we're sending some tests to London as well. Is that an option that Windsor Regional or our health unit could look at?
I don't mean to throw this out here because it's not the time, but if we had a new hospital, we'd have called a clean room in the lab that could support that. We do not have a clean room. It would cost close to $1 million to build one right now to do this type of testing. So it's, from my understanding, what's called a level 3 lab. We don't have that currently, but that's our goal, is to have that in the future. So that's why there's a limited amount of testing labs, even in the United States for that matter, that do this type of testing. So they're opening up, I think, 6 or 7 more labs in Ontario this upcoming week. We will gain access to the London one, and we're confident, or guaranteed, that the testing results will have a quicker turnaround than the one lab through public health in Toronto.
Okay. Another question here from Frank is a good question. We talk about ventilators, we talk about flattening the curve to ease what is happening at the hospital. How many ICU beds in Windsor Essex are available that can support patients that get to that stage with advanced symptoms? Again, no confirmed cases from Windsor Essex County Health Unit's tests of a positive case of COVID-19, but we're all anticipating at some point it will come here. When that does, how many ICU beds do we have to look after people in our community?
Well, I'll just talk about in general what we've been doing, not only here in Windsor, but across Ontario, getting prepared for this. So a lot of people heard the ICU beds, there's approximately 40 right now between the two campuses, but there's an ability to add more if need be, about 5 or 6 more if need be. But the bigger issue is, that's a big issue, having enough critical care beds for sure, but it's across the whole system. So it's not going to be one hospital is going to be able to pull this off. It's every hospital in Ontario has had to create capacity. And the way we created capacity, all of us, is through the what the government called pausing scheduled or elective surgeries. And that creates capacity because we're not doing those scheduled or elective surgeries. All we're doing is emergency surgeries. And as a result, we free up a bunch of beds. So as I'm sitting here on FaceTime today, our census at our two campuses is 67% and 62%. That helps. And the other hospitals in the Erie, St. Clair, Lynn have similar numbers, the acute care hospitals to that, because we have to look at this as not only a Windsor Essex issue or even a London Down issue, this is a provincial issue. We have 14 million individuals in this province that we're going to have to take care of. So as this unfolds, we have to create capacity locally in order to take care of patients across the whole province, possibly in Windsor. So that's what everyone's aiming for. That's what everyone's been working on for the last couple of weeks. And we're starting to hear more and more cases, and I call it, I don't mean to upset anybody by saying this, but we are literally in the calm before the storm.
Wow.
And but we're ready for it, and we're prepared for it. Our team's prepared for it, and we'll get through it together.
One of the things when we were reporting on that anticipation back when this was something that China was dealing with was the idea of isolation rooms. Have those been put into use, and how do they play the role after the idea of someone being tested for COVID-19?
Yeah, so interesting enough, if you go back on our website, I started sending memos on a daily basis to staff, and I pulled up the other day the first memo I sent, and it was January 22nd. Huh. And in that memo, it talks about China having 400 confirmed cases and 9 deaths. And look where we're at today.
Yeah.
If this unfolds, not only will we need our negative pressure rooms at the start and our critical care beds, but also, again, we have the ability to what's called cohort the COVID-19 patients in the various wards, which we will be taking care of them in. So that's what we've created at both of our campuses, the ability to do that, and other hospitals are doing the same. So it's not, if this unfolds and continues to grow, that's what we have to do. Really, the negative pressure rooms would be great if you had a whole bunch, but at a certain point, because of the volumes, you start what's called cohorting patients in wards.
We have been going through the comments here, and people have been leaving messages that they want to ask questions, and I believe we've brought up a few when you talk about the calm before the storm and sort of giving us a sense of what people are dealing with. Someone wants to know how we can help the healthcare professionals who are on the front lines. What can the public do to make lives for them easier? There's a time where we have some people, fortunately, some time to think about how they can help each other.
Just support them as much as you can. There's some unfortunate people on Facebook that just Facebook, on social media,
yeah.
That just really are, it brings out sometimes the best in individuals and sometimes the worst. And you got to support the frontline staff. They're doing everything they can to protect you as a community. So issues like visitor restrictions, that's needed. And it's horrible if you have a loved one in the hospital right now that you want to go see. But you're protecting not only your loved one, but you're protecting the staff to protect other people. You're protecting yourself. The last thing you want to do is be the person bringing it in to the hospital, giving it to your loved one, and or vice versa, getting it and going out in the community and spreading the COVID. So that's the purpose of the provincial medical officer health saying, listen, visitors are pretty much totally restricted. So it's for the frontline staff, it's supporting them. If you see them out in the community, say thank you, because they're working their butts off.
No, that's a good way to end it there. Thank you again for taking the time to speak with us. I know these updates are coming constantly, and I appreciate what you and the team are doing there.
Thank you. Take care. Stay safe.
Yes, you as well. Thanks.
Take care.
I'm just going to hang up on him there quickly. I apologize again for the way things are looking here. We do have some breaking news. This just coming into our newsroom. You saw a producer hand me this piece of paper here. I'm just going to come over to the desk here. We do have some new information about a COVID-19 positive test. The Minister of the Solicitor General says that they have been informed by the Public Health Unit that an individual who was performing maintenance work at the Southwest Detention Center has tested positive for COVID-19. This individual is said not to have been directly involved with the care or custody of inmates. Upon receiving this information, the ministry says it's undertook a deep clean of the area that the individual was working in. Staff at the jail have been notified to monitor their own health and to report any changes in their health to upper management. Now, that's all the information that we have right now. What we can tell you is that, and as we just heard from the hospital's CEO right there, Windsor Essex Health Unit is in charge of letting us know who tests positive or negative for who they test. And that's where this has all been funneled through. So we're continuing to get updates from them. We're continuing to get updates from Chatham-Kent Public Health, and we're continuing to get updates in Sarnia as well. So we can confirm this news coming into our newsroom that somebody who was performing maintenance work at the Southwest Detention Center did test positive for COVID-19. We're going to work on more details for that story there, and we will have that posted on our website at cbc.ca/Windsor. Before I leave you, I want to remind you once again that the City of Windsor is under a state of emergency. The release that was sent into our newsroom says that does allow for people to close down temporarily Devonshire Mall and Tecumseh Mall. You might still see some places open. A pharmacy was listed as a specific example of a possible exemption, but that will take place as of Saturday. Those details are on our website. It is as after the operation hours end on Saturday there, according to the release. And that's all the news that we have right now at this moment. If you have any other questions, we are available at windsor@cbc.ca. We'll continue to provide updates. We're heading into the weekend, and we will be there for you as well for those daily briefings that happen. We know that the Windsor Essex County Health Unit is saying the next one will happen on Monday. If that changes, go to our Facebook page. It's the best way to follow those updates. And we'll continue to provide you updates on radio, as well as the social media platforms that we have. That's our Twitter feed and our Facebook feed at CBC Windsor for both of those. Thank you for watching. Have a safe weekend.